Ulcerative colitis is an inflammatory disease in which the inner lining of the large intestines and the rectum become inflamed. So it's mainly characterized by diarrhea, abdominal pain, and blood in stool. So this disease may vary in how much of the colon is affected and in severity as well. The difference between ulcerative colitis and Crohn's disease is that the inflammation only occurs in the inner lining of the bowel in ulcerative colitis, while the inflammation can affect all layers of the bowel from Crohn's disease. Symptoms of ulcerative colitis. The symptoms of ulcerative colitis vary person to person, but today we're going to talk about the most common symptoms. Number one, the main symptom of ulcerative colitis is bloody diarrhea. So the bloody diarrhea in ulcerative colitis happens due to the inflammation, ulcers, mucosal damage, frequent bowel movement, and infections. So all these lead to fragile blood vessels, thus leading to bleeding of the colon. Number two, frequent bowel movement. So this comes as a result of inflammation, ulcers, poor water absorption, immune response, and nerve stimulation. Number three, abdominal or rectal pain. So this comes as a result of muscle spasms and anal fissures. Number four, fever. So this happens due to inflammation and severe disease activity. Number five, weight loss. So this comes as a result of poor nutrient absorption, loss of appetite, and frequent diarrhea. Number six, joint pain. So this happens due to inflammation, cytokine release, and autoimmune reactions. Number seven, skin rashes. So this happens due to immune overreactivity and cytokine release. Number eight, constipation and rectal spasm. So this comes due to inflammation and frequent bowel movements. Diagnosis of ulcerative colitis. In most cases, a thorough physical examination and careful monitoring will help obtain an accurate diagnosis. So a doctor will monitor before and during an ulcerative colitis attack with blood work and a colonoscopy. The colonoscopy gives the care team valuable information by noting the length and extent of the attack. So another good indicator of severity of the disease is how often and how loose and bloody the diarrhea is. Then a doctor will especially look to see if the frequency of the bowel movement increases during an attack. Then the doctor will order for blood tests to confirm the diagnosis. So let's talk about other diagnostic procedures of ulcerative colitis. Number one, imaging scans. So these imaging scans allow your doctor to get detailed information of the affected area. So these studies include computed tomography, I mean the CT scan. So a CT scan is a powerful X-ray that is very useful in diagnosing ulcerative colitis. It provides accurate images of the bowel wall. So we can also talk about barium enema. So here barium preparation is inserted through a rectal tube. So this tube coats the entire colon. Then X-rays of the colon are taken. Number two, flexible sigmoidoscopy. So if you have lower abdominal symptoms, you may need a flexible sigmoidoscopy. A sigmoidoscopy is a type of an endoscopic procedure that allows your doctor to examine the colon from the rectum. So it takes around 10 to 20 minutes. So a flexible sigmoidoscopy examines the rectum and lower colon during the procedure. So your colon must be clear of stool so as your doctor has good visibility. The preparation may include a liquid diety, enema, and laxatives. So your doctor inserts a sigmoidoscope, which is a thin flexible tube through your rectum and into the anus and large intestines to view the area. This procedure might cause some cramping and discomfort. Number three, colonoscopy. So a colonoscopy is similar to a flexible sigmoidoscopy, but it takes longer, 30 to 60 minutes. And it also allows your doctor to examine the entire large intestine. So during colonoscopy, your colon must be clear of stool so as your doctor has good visibility. So preparation may include liquid diety and enema. You are sedated before the procedure, then your doctor inserts the colonoscope through the rectum and into the anus and large intestines. So a biopsy forceps may be inserted through the scope in order to remove sample tissue for proper analysis. So this procedure might cause some cramping and discomfort. Thank you very much. I made Mojo. Please follow me up, like and share my video.